The first thing that you'll need is a tray. You'll also need dissecting tools, such as scissors, a blunt probe, a sharp probe, and what you'll mostly be using for today are forceps. When your specimens arrive, they're already bagged up and contained in a container like this. Sometimes they'll be marked as to whether or not they're male or female. This specimen is a female. The first bag is sealed with a rubber band. We're going to remove and save this rubber band for the future. Keep that over here. And your specimen is double bagged. Take your cat out and save the bag for later. Save that with the rubber band for later. Now we'll need to get the specimen out of the bag, and that'll take just a moment. The cat's been removed from the bag, rinsed, and drained. Your specimens are typically already skinned, with just some skin on the head, forelimbs, and hind limbs left over. Now we need to begin our dissection. The first dissection takes the longest amount of time because it's mostly clearing out the connective tissues in order to be able to see the muscles very clearly. Connective tissues, including things like nerves, are going to be removed from this specimen. We don't really learn the nerves on the cat, so you can just clip those away and get them out of your way. To start with, in an area that's lightly colored, which is usually fat or other connective tissue, just start pulling away the connective tissue. We'll drop it on the edge of the tray for now, but you just want to start getting things nice and clear and clean. Generally, if you can tear it away with your forceps, then you don't need it. Notice that there are connective tissue layers that look almost like cobwebs between the connective tissue and the muscles. You can take that away with your forceps, with your fingers, or with your probes, depending on what you're most comfortable with. I'll be using my forceps primarily, and you can already start to see a line here and the difference between the musculature and the connective tissue. As you just tease away these differences, you'll be left behind with just the muscles to study for class. So I'm going to focus on removing the connective tissue surrounding this broad muscle here, the latissimus dorsi. As you get this separated, you'll be able to lift up the entire latissimus dorsi, again breaking any connective tissues that underlie it with your fingers to expose the entire muscle. So you'll be able to lift this up and say, this is the latissimus dorsi. Now once you start clearing things away, you'll get a better feel for what is and is not important on the body. But again, as you pull, this wispy stuff is the things that can be removed. Where the muscle attaches to the body wall, there's often a lot of connective tissue that some people are scared to remove. You don't need to be scared because you have this video explaining to you that it's totally okay to pull this away. If you can see the line of muscles here versus connective tissue, you can go ahead and make that cut. Flip the specimen over to its dorsal view to continue cleaning. And what you can see here is this lumbodorsal fascia. We're not going to remove that connective tissue. And as you move anteriorly, it may become clear that there's another line of muscles. So the musculature is moving this way, and then there's another piece of muscle here. This is the spinotrapezius. And this is a very thin muscle. lying on top of the latissimus dorsi. So now we've dissected two muscles. The latissimus dorsi is in view here, with the spinotrapezius muscle being isolated separate from that. This generally has a triangular shape to it, running over the body, and we can keep working anteriorly to separate the spinotrapezius from the acromiotrapezius. This vessel here I'm going to cut and remove. We don't need to know that vessel for later, and it's obscuring our view of some of the musculature. So now we have that spinotrapezius here, leading up to the acromiotrapezius, which delineates down the shoulder blade, leads into the spinodeltoid, this region here, spinotrapezius, acromiotrapezius, and clavotrapezius, clavobrachialis going down here. So if you pay attention, the grain of the muscle is going this way, and then the grain of this muscle is coming that way. That's going to be the levator scapulae. There's the nice clavotrapezius, levator scapulae, acromiotrapezius, spinodeltoid, clavobrachialis. This is the lateral head of the triceps. This is the long head of the triceps.